Begin by performing hand hygiene. Apply hand sanitizer, covering all surfaces of the hands, and rub until completely dry. Explain the procedure to the resident. Provide for the resident's privacy. Fill the basin with comfortably warm water. Raise the bed to a working height. Put on gloves. Turn the resident or raise the hips. And place a waterproof pad under the resident's buttocks. Expose only the perineal area. Separate the labia. Using a washcloth with soap and water, clean one side of the labia from front to back. Using a clean portion of the washcloth, clean the other side of the labia from front to back. Using a clean portion of the washcloth, clean the vaginal area from front to back. Using a clean washcloth with water, rinse one side of the labia from front to back. Using a clean portion of the washcloth, rinse the other side of the labia. Using a clean portion of the washcloth, rinse the vaginal area from front to back. Pat the area dry. Assist the resident to turn onto her side, facing away from you toward the center of the bed. Using a clean washcloth with soap and water, wash from the vaginal area to the rectal area. Use a clean portion of the washcloth with each stroke. Using a clean washcloth with water, rinse the rectal area from front to back. Use a clean portion of the washcloth with each stroke. Pat the area dry. Safely remove the waterproof pad if used. Position the resident comfortably on her back. Place soiled linen in the designated laundry hamper. Empty, rinse, dry, and return equipment to storage. Remove gloves by turning them inside out and dispose of them properly. Lower the bed if it was raised. Place the call light or signaling device within easy reach of the resident. Maintain respectful and courteous interactions at all times. Final hand washing. Turn on the water. Wet hands and wrists thoroughly. Apply soap and rub hands together using friction. Scrub hands for at least 20 seconds. Interlace fingers with fingertips pointed downward. Wash all surfaces of the hands and wrists. Clean fingernails by rubbing fingertips against the palm of the opposite hand. Rinse hands and wrists thoroughly under running water with fingers pointed downward. Dry hands and wrists starting at the fingertips using clean paper towels. Discard used paper towels. Turn off the faucet using a clean dry paper towel and discard it. Do not recontaminate hands at any time during the hand washing procedure.